Gallbladder surgery is one of the most common procedures in our country, with more than 600,000 people getting their gallbladders removed each year. Joining us with more is Dr. Lisa Iucci, a general surgeon with Premier Surgical Network in Egg Harbor Township. First of all, what is a gallbladder? How does it work? What does it do? And why do so many people need it removed?
So a gallbladder is a little pouch of bile. It stores bile for your liver. And anytime you eat fatty foods, it squeezes and releases that bile to help you digest it. And so that's when we run into trouble, is when people are having these high-fat diets, it's overworking. And every time that it squeezes, if you have stones within it, it causes that pain that people complain of.
Why are we seeing so many younger people with gallbladder disease and gallstones?
I think it's because of the diets, the high-fat diets, and also just in general, people are more obese. And for whatever reason, that bile concentrates cholesterol, and most of the bile stones that we see are from cholesterol.
Why can people live without a gallbladder?
So your liver actually makes the bile, the gallbladder just stores it. So once we remove the gallbladder, some people do have symptoms for the first few weeks after removal, including like diarrhea, frequent stools, because they're unable to digest that fat. But the liver actually accommodates for it and makes up for it within a few weeks.
Amazing how the body works. And so when you do the surgery, how does it actually work? It's done laparoscopically, right?
Yeah, so typically we do the surgery laparoscopically. Everybody does a little bit different flare depending on your surgeon, 3 incisions versus 4. And there has to be one incision that's a little bit bigger because the gallbladder has to come out. And depending on how big the stones are within the gallbladder, we have to get them out of that incision. But what we do is we use the laparoscopic camera, identify the gallbladder, release it from all its attachments, and then we actually clip off the end of the gallbladder where it meets into your duodenum, your small bowel. We clip that duct, and we also clip the artery, and then we take the gallbladder out.
Fairly simple and successful surgery.
Yep, relatively simple. It's a same-day surgery as long as you're not having any acute symptoms. Usually you don't even have to stay in the hospital.
And where can people learn more?
PremierSurgicalNetwork.com.
Thank you so much, Dr. Lisa Iucci of Premier Surgical Network.